Good afternoon. My name is Ryron Traylor. Welcome to this discussion about improving vaccination rates among African Americans. We all know that this problem extends beyond the state lines of Georgia and even that of the United States. In seeing the big picture, this concern has affected the health care of our entire nation. So, how can we get our country moving forward in working to improve the rate of fully vaccinated African Americans living in rural communities? Dr. Dana Kahan led a conversation discussing the science behind information and how it's communicated. And during that discussion, he said that facts don't change anything, it's the lived experiences. We all know that there are deep cultural divisions on conversations about vaccination. How do we change this ideology? How do we move from a mindset of, does this information pertain to me? Dr. Kahan also said that if a pluralistic democracy can find a way to unite their diverse citizens in recognition to the science, that it is most essential for their welfare. As we transition from the thoughts of Dr. Kahan, think about this scenario. A family reunion in rural Georgia with an African American family. People were outside gathering, having a good time, standing around the barbecue, and there's this discussion that starts about health care, health providers, and vaccines. During that conversation, some of the elders in the family start to reminisce about their experiences. And we all know how important learned experiences are. Although I made this out as a hypothetical situation, this happened to me. Unlike many Americans, especially many African Americans, I've had 20 years of hospital and patient delivery experience. So in my family trusts my opinions, regardless of their situations that they have experienced in the past. So scenario one was different. So think about it this way. In this abstract, we're going to talk about the idea of they did it once. Why should I not trust that they will not do it again? One example that I found in some research was a comment that was made or a statement that was made. For example, one African American man reported, I hear people, I hear tall tales. Someone will say it will paralyze you. They're injecting a live virus in you and it's going to kill you. No, I'm not going to do it. These remarks were made when a comment discussing, governmental subsidizing or health care. One story that was shared was the Tuskegee experiment. Even though this had nothing to do with vaccines, we all know that conversations surrounding healthcare are all common. And this has had a tremendous impact on the vaccine, the flu vaccine and COVID vaccine rates for African Americans. Data from the Center of Disease show that between 2015 and 2016, that there's an estimate of only 37% of Black adults were immunized compared to 45% of white adults. The Tuskegee experiment. Now, recently in class, I asked several of my students about taking the vaccine. and many shared that they would not, that they had talked to their family members, and they advised them not to. During those conversations in class, I actually pulled up an article about the Tuskegee experiment. Out of 32 students, only 4 even knew what it meant or what it was. Following that, I had all my students do a homework assignment and ask their parents their opinions about the vaccine and the vaccination and why. And several returned to class the next day quoting things from their parents about the Tuskegee experiment. So we know that this is definitely something that resonates in the minds of African Americans. This proposal will discuss 3 specific aims. The first one is to check the level of interoperability among data systems at multiple levels. We will look at the county, the city, and as well the CDC. Throughout this qualitative review, we will look at articles and surveys of testimonies of people among the African American community. There's always been a black cloud over public health and government. It is imperative that everyone understands the hesitancy among vaccines. As a result, this affects the entire nation when it comes to our ability to achieve herd immunity. Despite the terror of devastation that COVID was causing in black communities, it was not surprising that many perceived this vaccine as a way to cause harm to their family members. The distrust that they have has not changed. In our community, I serve on the board for our health department. And when we rolled out our vaccination efforts, I made sure that I was there to participate. I stood out there for hours helping to greet people as they drove up to make them feel comfortable about getting vaccinated. In a community like my community, it's very important for African American males, females, or anyone to show up and smile and make everyone feel comfortable. As a result, our vaccination rates were pretty high during the initial phase of this effort. As we begin to look at the data from our community and the rest of the state, we realized that there was a substantial difference in our vaccination rates of African Americans and in many other parts of the state. Some made the conclusion that it was based on the leadership in the community. In our specific aim number 2, we're going to talk about why is this information not inoperable. In this aim, we will do a review of literature to compare African Americans living in rural communities to those in larger cities. The idea is to determine if the rate of fully vaccinated African Americans is different. This will be done through a t-test using a basic bivariate comparison of information. Next, we will use qualitative data from interviewing college-age African American students. In this, our attempt will be to identify areas where students have been exposed to lived experiences from their parents and grandparents that are impacting their decisions. Next, we will check the level of validity of this information based on information that's provided from the county, state, and on the CDC national levels. During this section, we will use descriptive research studies to show the inconsistencies in the collection process of information throughout the county, city, and the CDC. We all know that if information or the interpretation of questions are not consistent, then the information received will be inconsistent. There are operational concepts that will help us discuss studies based on geographic, economic, political, and environmental risk factors. There are studies that show that research has long suggested that ill effects of the Tuskegee study extend beyond those men and their families to the greater whole of the Black culture. As I finalize the aim 2, I will then separate the data into common themes with the hope that finally the study will help to encourage to change the culture of the target population. Now, specific aim 3, how to get the country moving forward, working to improve their rate of fully vaccinated African Americans living in rural communities. In this section, we will look at trust and mistrust. Although levels of trust in the community figures differ in different communities, we all know that it is high school nurses, pediatricians, mothers, fathers, disease survivors, and local physicians are the ones that impact decisions within small communities. These findings suggest that vaccination campaigns geared toward African American parents may be strengthened by including other non-medical African American spokespersons who convey their community's contributions to this message. When it comes to the strategy or approach of utilizing leaders, pastors, principals, teachers, people of influence in African American cultures or communities, we expect that we will be able to turn the needle when it comes to how people feel about healthcare and vaccinations. We know that there's remnants of the Tuskegee experience, and there's also barriers of small populations, but we know by having real conversations with real people will allow them to have answers to real questions. The long-term goal of this research project is to review the vaccination rates of all 159 counties in the state of Georgia and identify those that have populations of over 25% African American, but are on the lower side of the complete vaccination rate for the state. We believe that this study will help to encourage a change in culture and a target in this targeted population. As a result, the purpose of this study is truly to examine the relationship between data, fear, and vaccinated African Americans living in rural communities. The framework of this, the establishment of the data and the concept will allow us to look at the relationship between the variables and the stigma around vaccinations. This stigma will allow us to examine interventions and to look at the effectiveness of them and assess how they can be impacted or improved in these communities. It is imperative for everyone to understand the rationale of the decision-making process and how vaccine hesitancy will affect the entire country. Although to some it might be surprising, but as an African American male, I know that stories, interpretations last for a long time. In an article, A Generation of Bad Blood, it states that the Tuskegee study was the most enduring wound in American health science. The public health science ran a 40-year experiment on approximately 600 rural African American men, 200 without syphilis, 399 with it. The research has long suggested that ill effects of the Tuskegee study extended beyond those men and their families to the greater whole of the Black culture. To ensure that we have enough data to review on vaccinations adherence in African Americans living in rural communities versus urban areas, we may use primary data collection surveys. This will give us an opportunity to focus on this key group. Throughout this research, I was able to pull a lot of resources. And although there are a lot of resources out there to discuss the importance of vaccinations, the history behind the communication of medical history and vaccination needs, there are gaps left that show how to improve the communication of this information to this target audience. Currently, African Americans spend a lot of time communicating amongst each other. The stories, the lived experiences are shared over and over through generations and generations. In order for us to move the needle and improve the vaccination rates, we've got to look at resources and look at how they are communicated. We have to look at studies and see how the information was gathered. We have to look at the inconsistencies of the data that's been collected. But ultimately, we have to figure out a way to make people feel comfortable with our healthcare system that they feel has failed them. Thank you so much for your time today. I hope that this idea, this proposal, the research that was done will help to enlighten you on the importance of this research and knowing that if we can change the dial, move the needle on African American vaccination rates, not only in rural Georgia, but throughout the state, throughout the whole United States, throughout the entire country, that by doing this, we can achieve some of the health expectations that we know that our country needs. We have seen this work with polio and many other vaccinations across the world. But right now, the focus needs to be on how can we get people in this community, in the African American community, to trust the process, to trust the government, to trust public health, to trust the vaccines. Thank you again. And if you have any questions, please share them below.